Hi, everyone. Thank you for being with us today. It's Wellness Wednesday, and we're back. I was on holiday the last week, so I'm so thrilled to have Dr. Keith Berkowitz join us today. Obviously, can't say your name today, Keith. Sorry. I'm going to just let Keith. We're going to talk about the COVID-19 issues and the latest research and vitamins. Keith, I forgot how to say your name. I don't know what happened to me all of a sudden.
Yeah, I get that brain fog once in a while too.
I was like,
It's
what's
early
his
for
name
you.
again?
Remember, it's the afternoon for me. It's the morning for you. So it's a difference.
I just came off an Instagram live, so I'm all talked out. So I'm going to let you do most of the talking today while I sip on my vitamin C.
How appropriate, right? What an intro, right, to what we need to talk about. So
Exactly.
actually, I've had yours already this morning. I made mine this morning.
Did you? Doesn't it make
Absolutely.
you feel energetic? Like, don't you feel good after?
Oh, I love it. So, and I've been doing it every day, and I think I'm getting younger. I don't know if you can tell.
Yeah, you look like you're reversing the signs of aging. So Keith, let's talk about COVID-19 because, we first started talking about it in March when the pandemic hit. And again, we're still in this pandemic. For some countries, we're in lockdown number 2 in the United Kingdom and various parts of Europe. What it's almost like as we learn more, I mean, 2020 is kind of the year of confusion, COVID confusion.
Oh, yes, yes. I think we're
You
just
know,
going to wrap up this year and skip it next time, you know?
yeah. But,
And what's interesting about the UK, you brought up, so
yes,
they're actually having a second wave. So people are actually getting second infections. I've been hearing cases where people got infected last December and now
right.
getting maybe a different strain of the virus now.
Which is what we talked about in March about the mutation of the virus. And so for everybody listening out there, I want to just talk about what is a virus, because a virus is actually not living. Okay, so just so everybody knows, this virus is not actually alive. Because I think there's a lot of confusion around this. And I think people are just so sick of hearing wear a mask, wash your hands. We have to explain what that means and why it's important. Like
Yeah.
what does all of this mean?
Isn't it ironic that this non-living creature, is causing all this damage? And this tiny little creature, that's the ironic part.
So
Tiny,
small.
tiny little thing that is like wreaking havoc on the world today. I mean, it's so interesting. Today in the U.S., they announced 130,000 cases, which is the highest it's been. And we're now over 10 million. And, here we are in November, and cases are rising pretty quickly again.
That's inevitable because we're indoors. It's colder. It's Thanksgiving. It's Christmas coming. People's birth. People are fed up of staying indoors. It's affecting mental health immensely. So
Yeah,
we
and,
need to
and
do.
the problem with viruses, I mean, if you look at viruses traditionally, we don't often have a lot of treatments for them, right? It's a lot of supportive care. We look at, ones we've seen like infectious mononucleosis, which comes from Epstein-Barr, famous one we hear about. Influenza, there is a vaccine, but a lot of times it may be at its best year in the last couple of years, 30% effective. So we've had, a lot of issues with treatment. And a lot of times people talk about supportive care. And I think from a healthcare perspective and a patient perspective, that's pretty frustrating, right? You have this little virus, this little tiny thing, and we haven't had great treatments for it over the years. And the thing about viruses, what's interesting is they don't necessarily go away so easily, that they
No.
kind of live with us a lot of times. Great examples are things like herpes simplex, right? That is dormant in the body, and when your body's under stress, comes out. Epstein-Barr seems to behave that same way. A lot of people talk about that in chronic fatigue syndrome. So, I mean, and now we have SARS-2 or COVID-19, our newest virus that's really, you open any internet browser, the front article is going to be about COVID-19 today.
This is like the Brad Pitt of viruses. It's super famous globally, and it's so contagious, So I think that's the way we need to look at it. And it's like not all viruses are created equally, and there are some other viruses that are out there that we don't even know about that are
Absolutely.
causing havoc. It's just we know about this one, so we're tracking it.
And one of the problems is testing, right? Again, if you don't have a specific test, we don't know. What's ironic about SARS-2 is it's not as deadly as SARS-1. but it's so much more contagious. And one of the studies I read early on talked about for every interaction, so one person gets it, they're going to spread it to 2.2 people.
Right.
So that's really impressive. So you see really the growth. And
Yeah.
what's interesting is, and I'll talk about in a second, is the age group that's getting it has changed, right? Early on, we saw a lot of older people getting it. Actually, if you read back a couple months ago, the average age was 48 of people receiving it. The young age, under 50.
That's because we didn't know. That's because we didn't know about it, right?
Yeah. And that the average age has dropped to 38, which is, if you think about it, to drop that number so far, you're really seeing people in their 20s and 30s that are really becoming infected. I mean, if you look at colleges, you know, I have 2 college-age children, and we've gone through this, it's spreading like wildfire. I mean, you're seeing a lot of colleges close down. You're looking at cities locking down, like London, right, is going through a lockdown now again. And I think, you know, we thought we had this virus under control, but yet again, it has, you know, revved up tremendously and spread, again, very infectious, you know, and I think that's the problem. One of the good news is I think we're treating it better in the hospitals, so we're not seeing that death rate or mortality rate that we did before. And I think that's
and it was the
positive.
protocol that you mentioned at the very beginning of the pandemic, which was really interesting.
Math Plus, I love that, my favorite name. So when people started using a combination of steroids, and what's interesting about steroids is it brings me back, and I mentioned this before, when I was doing my training, I did it during the HIV epidemic, and there was a disease there we saw in HIV called pneumocystis carinii pneumonia. And what's interesting is that was treated with an antibiotic and steroids. And the CAT scan, or the imaging study of that disease, is almost the same with what we see with COVID-19. It's so fascinating. And we've learned that now steroids, vitamin C, thiamine, and in cases where inflammation's really overrun, you know, blood thinners like heparin or even aspirin can be used.
Absolutely. So let's talk about the fact that, why do you think that the COVID-19 is spreading more in the youth? Like, what is different about now than before?
Well, if you turn on Instagram and see the pictures that people are taking, that's part of it. I think this is a Halloween resurgence. So we think of Halloween, October 31st, roughly about 2 weeks ago, parties. You see all these people posting pictures without masks, in close contact. And one of the things they always talk about, CDC talks about, if you're spending more than 15 minutes in close contact indoors, you know, the risk of exposure is really much, much higher. And we're seeing more events happening. Also, I think we're seeing a little bit of fatigue where people are not as careful, you know, as before. I think the older population is very, very careful right now. And I think that's why we're not seeing, you know, them getting as sick as before. But the younger people are back in school. Colleges started in August and September. And I think that's where a lot of the spread is coming from.
I mean, even, you know, at the beginning, it was just like everybody was just staying indoors. And, you know, I think the summer happened. I even went out for dinner a few times, you know, social distance dinner, and hung out with the same people that we regularly tested. But, you know, there comes a point where I think, you know, if you think about, Keith, you and I growing up, you know, in our, you know, university years and, you know, teenage years.
That was yesterday for me, by the way. That was yesterday.
Totally. How are those people, like, mentally being able to, like, you know, we're social creatures by nature. So I think that is part of it. It's like the mental health aspect of this is a real issue.
Also, they're so close living together, right? Think about it. You're in a dorm. You have a roommate. You're sharing bathrooms with other people down the hallway. So that close contact. And what's interesting, even though, and this is what my daughter told me, who's a freshman in college, that they have social activities within the dorm, but you have one person test positive, all of a sudden 50, 60 other people end up testing positive. And that's the problem. And now come Thanksgiving, our worry is that these people then are going to come home. And then you're going to see rates explode again from that contact.
So there are different kinds of testing, like this, the oral swab, the nasal swab. You know, there's been a lot of talk about, you know, what is the best form of testing. There's antibody testing, you know, there's IgM and IgG in terms of antibody testing. And people being tested if they've been around somebody with COVID-19 and then it turning out to be negative. You know, they're not probably waiting long enough to get tested for incubation to occur, to then, have a result. And then that negative result gives them false, that they're actually fine and they can be around other people.
And you see, like, even the populist rapid testing, and you see a pretty high error rate where you'll miss it. And what's interesting is, when do you think, the question becomes, when are you most infectious, right? So when you're most infectious, that's when the positivity rate is going to be the highest. And
Yes.
really, people really think it's 2 days before symptoms begin and 6 days after symptoms start. And people get it. Ironically, the highest positivity is on day 8. So it's about 80% on the PCR test, which is the very uncomfortable nasal swab. If anyone's have it, you know what it is. And I think they reach up almost to your brain and take a sample.
You don't have to. You don't have to. You don't need to go as far, because I run a lot of those tests. But so I want people to know that they can get that test and it's not as bad as you think.
And it's important. But what's interesting is that's day 8. Think about it. That's already at the end of the viral replication period.
Yes.
Right? The typical viral replication period is day 1 to 7. But you're not getting a positive test until you're already past that point. Again, it's when the body starts to really react to it. And if you look at antibodies, IgM, which is the more acute, which really comes within 4 to 6 weeks, you may not see a positive test up until 2 weeks after, and maybe up to 6 weeks after. And I've seen in several cases where people were negative at first, and then 6 months later were positive. On the other hand, I'm seeing positive tests now turn negative. And I think the correlation with that is, it seems that the more symptomatic someone is, the higher the antibody level, the more likely those antibodies will last.
Got it. So if somebody's not symptomatic and they have a positive test, I've also seen it a day or 2 days later be negative.
Right.
So and people think, okay, well, is that person still contagious? Should that person still quarantine for another 2 weeks?
And what's interesting is again, so if you think about day 8, your infectivity rate is way down, right, from that point.
Right.
And now your test is positive. So you're really, in a sense, buying another week of isolation or from that aspect. And so that's the hard part of this. We really are not identifying this too early. And again, the other issue is younger people may not be symptomatic, so they may never go for testing, right? So if you don't feel symptoms, you don't have a fever, you don't have, someone asked what sign of symptoms, fever, chills, diarrhea is a common one. The one that I'm seeing more than ever before is headache. Really, that's the one that I didn't see as much early on. Those people don't always feel it, or they don't pay attention. People get headaches for other reasons. Right. And so they may never get tested. So they are working around as a carrier of infection. And, that's the challenge.
And it's also a challenge where you'll see like families, parts of the family are negative and parts of the family are positive. And it's like, how is that possible? Because I've been living with my family. Some people get it, some people don't. So it is confusing, but we have to remember, guys, that this is a virus. And, whether it attaches or it gets into your body or not is neither here or there. You still need to keep your body optimally healthy. And this is what we want to talk about, not just about COVID-19, but viruses in general. Keith, how can we keep our body healthy in terms of eating well, taking supplements? What are you telling your patients?
So going back to that, I love that question about why some family don't. So there's a couple of theories behind that. Mm-hmm. Number one is our favorite, right? Vitamin D. So it turns out that with very good vitamin D levels that, the rate of infection goes down almost by half. And what's interesting, what is good vitamin D levels? And I think our traditional there's a blood test that they looked at anything above 30. And probably you need to be closer to 60. So I think that's the big part. That's the big one. The other one I like is all these studies on blood type, right? Talking about different blood types. Right. That type O is less likely, by the way, type O, but less likely to get sick rather than type A or B or AB.
Type A in more than one way.
So it's interesting. So that people may get it not, and also again, it's also exposure, how you're being exposed, right? Remember this is a droplet aerosol disease. So the aerosol has to, spread around in the room. So if you're in a small room together, chances are much greater, or in a car or at a party where you're close together, that you're going to get exposed rather than being outside where there's more distance and stuff. And
so what can people do now that we're you know, all getting into cold weather, including here in California. The weather went from the 90s to the 60s within 3 daweeks.
By
So
the way,
we're
it's
having,
almost 70 here, but that's okay.
oh my God. I think, yeah, I have no idea. We've dropped down quite a bit. Not that it's a competition or anything between New York and LA, right?
Oh my God, New York is always worse. So for
I
once,
know.
thank God.
So, you know, this whole thing, we'll come back to your question about people having it more than once. We now that we've discussed the fact that the vitamin D levels are super important. When we look at places like the UK, for example, 80 to 90% of people in the UK that are tested for vitamin D are deficient.
Yeah,
So,
and North America, probably the same levels too, as well. I mean, you
yes,
see, tremendously high levels. And we talked about before that it's a fat-soluble vitamin that oftentimes, if you don't take it with food, you're not going to absorb it enough. And I think your food sources, we've talked about in the past, probably are not going to give you enough as well.
so
So, I
take
mean,
your vitamin D with an avocado, okay? Have it with
that
food.
anti-inflammatory avocado, remember, my
Yeah,
favorite food.
yes. When we talk about inflammation, Keith, and before we want to move on, talk about more viruses, inflammation is actually a good thing because it's a way of our body sort of responding to something that should be dealt with. It's the problem is when we're in constant inflammation. And this
Right.
is where when we have viruses, and that's including COVID-19, is that why we have this virus is how is this virus impacting the inflammatory cascade?
I mean, it's so interesting. So we'll talk about, you talked about acute inflammation. That's our body's way of fighting infection, right? You want inflammation, right? You want your body to say, okay, let's, get the troops together. Let's go attack. We got to
Yes.
defend ourselves. That's great. Yeah, but you want them to leave eventually, right? You don't want them to stay occupying that territory. And the problem, what happens is in a lot of these viruses and diseases is that inflammation never resolves. And that's where people get into. I mean, we talked a little about chronic fatigue, Epstein-Barr virus, which is very common, and some other ones that go along that just always there, and they're that constant inflammation, in a sense, is wearing down the body.
Yes.
It's utilizing resources that could be used better elsewhere, right? If you think about your body only has so many resources, you don't want it focusing on inflammation all the time, and you want the body to say, okay, I fought off that pathogen or virus, I'm done. Now I got to move on to other things. But in most cases, we're finding that doesn't happen. I mean, I know people have had, COVID-19 who feel the symptoms months afterwards. The big ones, especially things like headache, fatigue. One of the things that I find so fascinating I've seen is blood sugar. That I find post-infection that people have a lot of trouble with what I call reactive hypoglycemia, or what they do is have a lot of trouble stabilizing their blood sugar. They feel that brain fog, that tiredness, that fatigue, and when I've tested their blood sugar, that's pretty low. And the other one we started talking about is when I test vitamin C post-infection, the people that seem to be still sick often have low vitamin C as well. And remember, humans don't make vitamin C. We have to take it.
I know, I love that. Okay, so humans don't make it, bats don't make it, and guinea pigs don't make it, and some fish, right? So,
I wonder if guinea pigs are getting COVID. I've not checked on that one.
who knows? I mean, who's testing guinea pigs? We can barely get tests for humans. So we'll need to find out. I found that very, very interesting. And, dogs make their own vitamin C. And again, with us going through such a stressful time, with the pandemic, the global pandemic, and then we also have, we had stress with the elections. We're still having stress in the United States. You and I talked about the fact that Americans go through fight or flight, about 62 stress responses a day, and that was 20 years ago. So how many stress responses are we receiving now? And what do those stress responses do?
Last week, probably over 100.
At least over 100.
Last 2 weeks, way over 100.
Way
oh my
over
God,
100.
maybe 1,000.
And what does that do to our cortisol levels?
Well, it's interesting. So cortisol is also a depleter of vitamin C, right? And
Yes.
and your vitamin Bs, and that's actually what makes you also more susceptible. Your normal things to fight off infection are kind of being used elsewhere. So your body's like, okay, force shield is down, I'm going to be more likely to get sick. And again, everyone knows with any disease process, when you're stressed, And when you're tired and, you're going to get sick more often. And this is what's happening more and more.
Well, we know that high cortisol levels, when your adrenal glands, which are these cute little glands that sit right above your kidneys, they're important they trigger something called cortisol, which is your stress hormone. When you're stressed, this hormone really, really elevates, and it can actually suppress your immune function. It's supposed to elevate, but when it's constantly activated and then deactivated and then activated, then your adrenal glands stop producing the cortisol over a period of time. It's not like Addison's disease where your adrenal glands cannot produce any cortisol. It's just that they're being triggered all the time through the fight or flight response, which we know we're at least getting over 100 a day.
And that's so interesting because when you think of the inflammatory phase, which is really the second phase of the disease, viral replication being the first week, that's where people are getting hospitalized. And I think if you look at that group that ends up in the intensive care unit that's sickest, that's because the cortisol is out of control, where the body can no longer support its blood pressure. It can no longer support its immune system. And oftentimes that's why we use vitamin C and steroids together to give it that support. Remember, steroids come from the adrenal glands as well, too. Mm-hmm. So if your adrenal glands are so much in cortisol, it's not doing the other things it needs to do. And that's really so true. And again, when they've measured cortisol levels and things like that, they have found them to be low in that really severe acute phase. So cortisol and inflammation are really, the terrors in this whole disease process. We really have to, prepare against and protect against, right? We always talk about prevention. Keeping those well situated with proper eating, proper supplementation is really key in this process.
So what's the latest and greatest? Is there anything, I've heard about some new drugs that are on the market that actually are used for ear mites for dogs. And
I love that.
Humans have used it, for worms and things like that. Tell me about this particular medication. If you could just fill me in and let me know what it's all about.
So there's a medication out there, ivermectin. So ivermectin is pretty interesting. It was discovered in the 70s. People won the Nobel Prize. And it's really famous, actually, for not only, dogs get it every month, horses get it oftentimes to protect them against worms and stuff. But it actually was given out probably about 4 billion doses in the 90s and in the early 2000s into the continent of Africa to fight overwhelming worm infections. We use it for lice. Anyone that's a parent has dealt with that. And what's interesting, more recently, they've actually studied it as a prophylactic and a treatment medication. Peru gave out, I think, almost 500,000 doses and actually showed a pretty impressive rate in decline of disease. My favorite study in all places, Iraq, right? So Iraq did a study, and they did a family study, which was really fascinating. It was about 250 people, and they found if one family member was positive, they gave one group ivermectin and the other group not. So it turned out the group that got ivermectin, only 8% of the family members got COVID-19, whereas the control group, almost 60% got COVID-19. So it's a big difference. And we suspect in 2 doses, people get 12 milligram dose once and then another dose up to 3 days later, and some studies a week later, that it may be prophylactic. In vitro, which is in cellular studies with a test tube, in 24 hours, it kills off 99.8% of the virus. Pretty impressive.
So the nerd in me is asking, what is the mechanism of action? I can't really logically understand it. So I know because it's supposed to work as an anti-worm and dust mite. Is there something to do with the DNA and the RNA molecule? Is there something?
100%. It actually binds to nerve and muscle cells, which is really interesting.
Okay.
So it's able to, and it's very, see, we talked about lipid soluble, right? We talked about fat soluble. So it's very lipid soluble. So that actually is great because lipid soluble stuff, we talked about vitamin C a couple of weeks ago, right?
Right.
Lipid soluble vitamin C, 90% gets into the cell, whereas the water soluble, only 20%. Right. So the fact that this is so lipid soluble, it really penetrates well. And one of the big advantages is it's got pretty, mild side effects. So it's been well studied. Ironically, I read 2 studies in animals, because you can't find many human studies, that they were able to stop the side effects. One was in cattle, they gave intravenous vitamin C, and it blocked some of the side effects, ironically. And the other one they did, I think this was in rabbits, and in dogs, they gave vitamin E and selenium, two other antioxidants. So yeah, and great comment. Someone from El Salvador said that people are taking it. In Brazil, they're using it widely, in Argentina, and they're really seeing pretty good results and really pretty rapidly. I mean, and there probably over 1 million doses have been given in South America to the state already.
So is it stopping the replication of the virus?
Yes, and it seems to work pretty quickly. Within 72 hours, you do see a dramatic decrease. And again, in test tube studies, they measured almost 100% within 24 hours, which is amazing.
Amazing. I think if anything, this pandemic has taught us that we need to take care of our own health and manage our stress levels as much as, you know, we're watching the news and we're stressed out of our own personal life. Like everybody's going through their own personal issues. You're stuck in a house with somebody that you're not happy with, or, you know, your kids are driving you crazy, or your parents are sick, or your, you know, dog is sick, anything, you know, all of these stresses are now multiplied times 100. Everything's also more difficult to do. You easily can't access things. So what we need to do is, you know, we as human beings are super resilient, and we have all the things that we need to support. We know that the World Agricultural Association has reported that we don't have enough vitamins and minerals in our soil.
Yeah, I mean, if you ever do that experiment, so I did this experiment with my kids years ago, where you take a lemon and you would plug an electrode into lemon and plug the other half into a light bulb, and there should be enough conductivity to light the light bulb. It doesn't do that anymore. And we suspect that mineral counts are down over 50% from what they were in the 70s. That's incredible. 50% we've lost in our food supply.
It's incredible. And you know, a lot of people are not used to taking vitamin supplementations. People associate popping pills with like popping drug medications. And a lot of people will say, oh, I don't want to take any medication. And I'm like, well, this is not a medication. This is a supplementation. And it's very sad that we have come to that state where food is supposed to be our medicine. Food is supposed to be our healing. I mean, it still is. It's not to say you can go out and eat McDonald's every day and take vitamins. That's not what I'm saying. You can't, like, you know, eat McDonald's and, you know, terrible foods and then take vitamins. I mean, although it's better than not taking vitamins and eating those foods. But having said that, we still need our vitamins. We need our vitamin. If you're stressed out, you're going to need more vitamin C than you've ever needed before. You're going to need B complex. We talked, Keith, and you know, we talked about B complex and why B1, B2, B3, you know, B5. We need this for our neurotransmitter activity. We need vitamin D, because vitamin D, I want to talk about vitamin D in particular. We always talk about vitamin D, but I want you to talk about its mechanism of action. Like, what does vitamin D actually do, and why is it so important now than before? I want to be able to set the record straight with people that are listening.
So if we want to refer to what's going on with COVID-19, so vitamin D works on this thing called an ACE2 level. So there's a system in our body called renin-angiotensin system. Anyone who's had to take blood pressure medications knows very well about this. It's where most blood pressure pills work. So it turns out that this little COVID-19 virus likes to come in through what we call an ACE2 level. Good news, women have better levels than men, so they don't get sick.
We have less.
But it turns out vitamin D enhances that. And again, normal levels could drop, and there's really good studies showing up to almost 50% risk. That is huge. So just by taking vitamin D alone, you decrease your risk by 50%. And again, you're almost creating a shield around that entry point where the virus comes into the body. And that's so critical. And what's interesting through this, we've also learned, which is kind of cool, that vitamin D actually can work as a blood pressure drug in the same way, because it works on this system, and also be very heart protective. So we're learning both mechanisms are really important. Also, from another standpoint, it's your immune system really does not work without vitamin D. So you need vitamin D as part of that whole armamentarium to make the immune system work well. I mean, it's so critical.
And it's not just a vitamin, it's a prohormone. And
yes,
it works as an anti-inflammatory. Now, Remember, Dr. Keith and I are not your doctors. So we are here to give you advice. You need to find out from your doctor how much vitamin D you need, because you may need more than the average person. And, you know, that's why some people that even took vitamin D and said, hey, I took vitamin D and I still got really sick. Maybe you weren't taking enough, or maybe you weren't taking the right dose. Maybe you weren't taking the right form, and maybe it wasn't being absorbed because you weren't taking it with food. You weren't taking it with K1 and K2. There are different factors. It's different in conventional medicine, Keith. When you give somebody an antibiotic, you give them amoxicillin, you're directly giving them that drug, no matter where you are in the world. It's not going to be different in the UK as it is in the US. You're giving them, that's
and
the
same
thing about
dose,
drugs.
and the same dose pretty much.
The same
It's
dose.
interesting. So with vitamin D, I mean, the great news is we can measure it. Even vitamin C we can measure. So the great news is we can measure these levels and really say, okay, how much does the body have available? And that's really critical. And I think that's a great way to kind of determine. And I think we both do in our practice is we all, you know, when someone comes in as a new patient, one of the things we check right off the bat is those two levels, vitamin D and vitamin C. Because you can, the question is, can you take too much vitamin D? You can, because it's a fat soluble. It can be toxic in very high doses. Typically, people will feel digestive issues first when they take too much of it.
I don't see it very often, but, you know, obviously I monitor all my patients that I have on high dose vitamin D. And a lot of them have that VDR polymorphism that puts them at a risk for always having low vitamin D. And also, the darker skinned you are, right, Keith, the more likely you are to need more vitamin D than, say, somebody with a Caucasian, for example.
Yeah, and melanin definitely interferes with the absorption. I mean, it's very clear, which is the opposite of what I was taught when I was growing up. So interesting. I always thought it was the other way around, but it turns out that my lowest levels are in my most darker skinned patients. I mean, by far.
Yes. Okay. Anyone have any more questions? Keith, did we miss anything?
So we'll talk about prophylaxis, the other things people can use.
Yes.
I think that's important. So we talked about vitamin C, we talked about vitamin D. Another one is quercetin. So quercetin's really interesting. I learned about quercetin in the 1980s when I was training in HIV. It actually has antiviral effect against HIV and hepatitis C. It turns out it also works on COVID-19. It actually can kind of prevent the virus from assembling. The other one that's really critical and kind of interesting is zinc. So zinc is really kind of cool because a lot of the medications work through a zinc pathway. Like a lot of people talk about using like an antibiotic like Zithromax, and the Zithromax needs zinc to actually get to where it needs to go.
Yes.
So a lot of the other vitamins use zinc. They call it a zinc ionophore, that they use zinc to actually work. And zinc directly affects viral replication, which is great. My favorite new one, which I use regularly, is melatonin. So everyone's like, oh yeah, I sleep better, I should feel better. But melatonin also, and there's a huge study just released that people have been watching, shows that it actually really enhances innate immunity. Really kind of critical from that aspect that works on that. So those are, I almost call it like my toolbox. Those are the supplements I put in my toolbox to kind of prepare us and really protect, you know, my patients and my family from, you know, from this virus.
And the mechanism of action for melatonin, Keith.
So it's interesting. I'm not sure how it works. So the way it works for sleep, and it may have an effect, and this may be the reason. Melatonin is a great anti-cortisol, right? It keeps cortisol from being high, and that's what allows you to sleep at night. So I suspect that that has a big effect also on our immune system. There's a new article. Remind me next time we talk. I will talk about it on how melatonin, the mechanism on immunity, but it does have a good effect. And you know, people have been using it more frequently now as part of their protocol. And if someone wants to look at the protocols with the group I work with, if you go to COVID-19criticalcare.com, you can download the prophylaxis protocols for people symptomatic, and for the, you know, people who were sick in the hospital. Again, it's COVID-19 critical care.
I'm going to write that all in the post, everybody. So don't worry. I will write down all these recommendations that we talked about, and also that website that Keith has just reviewed. What about milk thistle? Well, that's interesting because milk thistle increases the amount of glutathione in the body. And we know that glutathione is super, super important, and N-acetylcysteine.
Yeah, so that actually brings up chicken soup. So we'll go to that one next.
Yes,
So, because
yes.
chicken soup is your
I get
source of
excited.
cysteine, and this was my grandmother's idea. So, which is nice. But what's interesting about milk, other effect is the people that are the most sick are the people with liver dysfunction, people with fatty liver. So milk thistle really helps prevent that because those are the people have issues with actually being hospitalized, and those are the individuals that most likely end up in the intensive care unit. So milk thistle is so important. For we talk about liver detox and keeping the liver working. That's so critical, and N-acetylcysteine does that as well.
Great, great. So let's talk about your grandma's chicken soup.
So I wish I could make it as well. We have to find someone to make it. So that's better than me. So
I made
what's
it.
interesting?
I made it the other day.
Okay, so this one we use celery, carrots, onions, parsnips. We call antimicrobial vegetables. But the two key components are carnosine. So carnosine really is a very strong anti-inflammatory that uses, and again, those help fight infections. But what's I kind of like, and people talk about with the common cold to use chicken soup. By the way, the common cold is a coronavirus. So we're dealing with very similar, is cysteine. So cysteine really helps the body break up mucus and clear our nasal passages so we can breathe better. And one of the things that leads to people being really sick in this virus is what we call hypoxia or decreased oxygen. So the more we keep blood, oxygen flow by keeping mucus out of our lungs and keeping it out of our nasal passages, the better people are going to do. And what's interesting about this, there was a correlation I read in one study that people who react poorly to the common cold are more likely to get more severe reactions to COVID-19.
Right. Interesting. And does milk thistle help with fatty livers to shift that? Absolutely.
Yes, and Silmarin is milk thistle. Yes, it's the same thing.
That's a whole other topic, but yes, fatty liver. Actually, you could say a little tidbit on fatty liver. We can add on to that.
So fatty liver is really interesting. So again, I think it's kind of almost epidemic in our population. So the group you're seeing a lot of it is your pre-diabetics or insulin resistant. They're developing a lot of fatty liver. And what's interesting is that when you get sick, one of the things that happens first is you get an insult to the liver function. And that's where the body really gets into trouble, where the liver can't filter through all these pathogens, this inflammatory cells. The body does end up really becoming much more sick. So being preventative from that and keeping those levels better really helps dramatically. And again, we always think of the other part is our hormones, right? It helps keep proper hormonal balance, which is very critical to keeping us young and fit and healthy.
Amazing. Keith, I love always doing our Wellness Wednesdays. If anybody has any ideas on what you want us to talk about next Wednesday, let us know. Otherwise, we will update you and let you know. Be here next Wednesday for Wellness Wednesdays. And I think we did our best today with the update. Every single day seems to be like a month of information. So we'll keep you updated.
I want to answer one question, one from London before. Remember about getting it twice. So what people are thinking now is that it's a different strain. That they think that there was really two main strains. One that often comes from Asia, and now this European strain. And it's interesting, a lot of even the European countries that did well the first round, like Germany, are really getting affected pretty quickly. So we think that it's interesting that this new strain may not be as dangerous, but it seems to be much more contagious. And that's what's interesting. We're seeing very high contagious rates very quickly, much more than even the first round.
Yeah, and not as lethal. It's not as it's not as pathogenic.
Right. And again, if you remember years ago, SARS-1, which was great about SARS-1, SARS-1 died out on its own. It mutated out. And so hopefully this will do. I mean, we haven't seen it yet, but hopefully and people should be careful now. If you go back in time and look at, our last really tremendous pandemic, which we call the Spanish flu, ironically was the Kansas City flu. It came from Kansas City, not from Spain. American soldiers brought it over during World War I.
Right.
And what's interesting about that is that more people died in the second wave than did in the first wave. So that's where we have to be careful and really be, more cautious about social distancing, taking care of our bodies, because like you said, we're headed into winter, and winter is, viruses like winter more than they like summer and spring and fall. So we have to be even more, protective and more vigilant and more careful.
And I really want to get into this, and maybe we can touch on this next Wednesday, is the post-COVID fatigue, because that is a huge one. We unfortunately don't have time to go over that now, but we definitely want to talk about the post-COVID fatigue, because that's super important, and that goes with any virus. And so stay tuned next week, and we'll talk about post-COVID fatigue. I think that'd be a good one to talk about. Thank you, Alexandria. We'll talk about that.
Great question.
Great question. All right. Happy Wellness Wednesday. Big kiss, everyone. Nice to see you.
Everyone be safe. Thank you.
Be safe. Bye.